Dry needling and the autonomic nervous system. The autonomic nervous system is the number one underlying target that I think about when I am performing dry needling on somebody. So without normal autonomic nervous system function, you guys, autonomic nervous system homeostasis is impossible, and that makes general health impossible. It makes optimal health impossible. It makes good mental health impossible. It ruins every single aspect of mental and physical neurophysiology as far as we know. So I always try to think about dry needling and any treatment that I'm performing from a first principle standpoint, or to try to work backwards to start from the most basic principles that we think we somewhat understand. So as far as I can figure out, that's the autonomic nervous system when we're talking about dry needling and how it's regulating the sympathetic and the parasympathetic balance of the autonomic nervous system. So remember, you guys, as far as we know right now, the autonomic nervous system is like a seesaw, right? As far as we understand, both the sympathetic and parasympathetic sides cannot go up at the same time. So if this is the sympathetic side over here, as the sympathetic side goes up, the parasympathetic side goes down. If the parasympathetic side goes up, the sympathetic side goes down, just exactly like a seesaw. What we want on the autonomic nervous system seesaw is a relative balance so it can wobble back and forth and be regulated by both sides. The sympathetic side should be on more during the day. The parasympathetic side should be on more at night. When we're playing sports, the sympathetics are going to be on more active things. Sympathetics are going to be on more relaxing things. Parasympathetics should be on more. However, the unfortunate fact of the matter is over 90% of the US population is living with chronic sympathetic nervous system autonomic hyperactivity, you guys. So chronic sympathetic autonomic nervous system hyperactivity. 90% of the United States plus is living that way according to our own public health agencies, the CDC, the FDA, the NIH, all the people responsible for bringing the country to this place. They all say in their stats that our country is in an absolute disaster area of health and nothing is being done about it. Because they want people sick, that's how they make money. So with dry needling, you guys, we can really step in and really maximally help people where they haven't been able to receive help before. If you understand how needling is working and how you can leverage the effective areas of needling treatment. And so, for example, how to leverage maximizing autonomic nervous system homeostasis. So remember, you guys, the average human condition, the typical human response to mental or physical stress, strain, pain, or trauma is to elevate the sympathetic nervous system, the sympathetic autonomic nervous system. Anybody with kids, anybody that's in significant amount of stress, poor health, all that stuff. So the vast majority of the people in the United States are living with chronic sympathetic nervous system hyperactivity, you guys, which is extremely detrimental to all aspects of mental and physical health. So the overall effect of needling, no matter how you needle, you guys, and this is very objectively observed in the literature, is that more or less, no matter how you needle people with these little needles, the overall effect of needling is parasympathetic dominance compared to baseline. So the parasympathetics are going to be elevated compared to where the patient started, which is perfect for us because if it was the other way around, nobody would ever needle. Acupuncture would never have been a thing because it would be pushing the autonomic nervous system in the wrong direction. It just so happens that when humans and most other animals that I know of get stabbed with these tiny little sharp pieces of metal, especially if you understand what you're doing with them, you significantly push the autonomic nervous system more towards homeostasis, or you depress the sympathetics, you elevate the parasympathetics, and you achieve autonomic nervous system homeostasis as a result. If you understand that that is what happens basically no matter what, then we can start thinking about, okay, if that is true, which it seems to be true, how can we leverage that fact and maximally elevate the parasympathetics and maximally depress the sympathetics so we can maximally induce autonomic nervous system homeostasis? That is the key to dry needling success. How much autonomic nervous system homeostasis do you induce in your patient each time you treat them? That is the most accurate underlying objective measure as far as how effective your treatment is going to be for your patients. It's the most objective way, at least that we understand right now. I'm sure we'll figure out better ways to figure this stuff out, you guys, but that's the most objective way that we have right now. So the primary parasympathetic nerve in the human body, again, as far as we know, you guys, I talk about this stuff, more or less like it's true, but you need to keep in the back of your mind that probably most of the stuff that we think we understand in medicine right now, we really don't understand. We have like some very surface level understanding of like a few mechanisms of action of how things like DNA and the autonomic nervous system and all that stuff work. We are really good at seeing cause and effect right now. So again, we know that when you needle people, the overall effect is parasympathetic dominance compared to baseline. Exactly how that happens, like all the little different pathways that needling is affecting, it's impossible to know because you guys, we only know of a very, very small percentage of all the pathways that exist in the human body. So just because like one of the pathways that we are able to observe doesn't show a significant like correlation, cause and effect, that has no bearing whatsoever on if it's actually happening or not. We can see that it's happening. The cause and effect we can see. If it's safe and it's effective, regardless of how well we think we understand how it's working, it should be used on patients if it's safe and effective. That is stuff that we are able to understand right now pretty darn easily just by doing tests and seeing what the outcome is. The in-between stuff isn't as important to helping people right now. Although I really love to know like all the science behind it, the neurophysiology, all that stuff. If it works, if it's safe, if it's effective, if it's not hurting people and it's leading to better outcomes, it's 100% worth it. So that's how I think about it. So the vagus nerve, you guys, the primary nerve of the parasympathetic autonomic nervous system, or the rest and digest part, that's not a super accurate term, but it's relatively good to keep in people's mind kind of what the parasympathetic and sympathetic difference is. So remember, sympathetic, fight or flight, parasympathetic, rest and digest. Sympathetic stimulates stuff, parasympathetic stuff relaxes stuff. In general, you guys, that's not true across the board, but just in general, right? The vagus nerve is called the wandering nerve. You guys, I think in Greek or Latin, the vagus nerve is called the wandering nerve. That's a much better term than the vagus nerve, because it's a really, really accurate term for the vagus nerve too, you guys. The wandering nerve, the vagus nerve innervates more unique, independent structures than any other nerve in the body except for the sympathetic chain, if you want to consider that like a singular nerve. So the vagus nerve comes out of the brain. It's a brainstem nerve, cranial nerve number 10. The wandering nerve, it connects the enteric nervous system or the intestinal nervous system to the brain, right? So the gut-brain axis is the intestines, the vagus nerve in the brain, or the enteric nervous system connected to the brain by the vagus nerve. The vagus nerve innervates almost all the organs, and so does the sympathetic chain, you guys. So we're going to get to the sympathetic chain in a little bit, but you need to keep in the back of your mind, for whatever reason, I think this is just one of those things in medicine where it started to be spoken about this way and it's just continued to be spoken about this way, but it's really not accurate. People always talk about, yeah, the vagus nerve is the primary parasympathetic nerve of the autonomic nervous system and connects all the organs together, connects the brains to the organs. It's our interoceptive awareness indicator, or 80% of the vagus nerve fibers are afferent, or 80% of the vagus nerve fibers are telling the brain what is going on with the organs, so then the brain can receive the proper information and then regulate the organs in return. However, nothing in our body works on just one side of the nervous system, you guys. There is an opposite to the vagus nerve, and it is the sympathetic chain. So just keep that in mind. We're going to talk about that. I have a slide or a PowerPoint specifically on the sympathetic chain, you guys. That should be thought about as the sympathetic vagus nerve, more or less. There's the vagus nerve is parasympathetic, and then the sympathetic chain is the opposite of the vagus nerve on the sympathetic side. And remember, the sympathetic chain has 7 plexuses that are like our individual organ regulators, more or less, or our individual organ sympathetic innervation systems, right? So we got the 2 hypogastric plexuses, the celiac or solar plexus, all those little plexuses that we learned about in school, you guys. those are coming off the sympathetic chain. So those are providing the sympathetic stimulus to balance the parasympathetic stimulus for the organ. So lots of people talk about the vagus nerve. Hardly anybody ever talks about the sympathetic chain. The sympathetic chain is the reason why joint manipulation is so important, in my opinion. So we'll get to all that stuff, you guys. So as far as locations to target the parasympathetic autonomic nervous system. So we have the sacral periosteum, or S2 to S4, right? The sacral plexus that innervates the pelvic floor musculature. That's a parasympathetic dominant portion of our spinal column. We have the pelvic floor itself, the pelvic floor muscles, which are innervated by S2 to S4. The suboccipital periosteum, and that is considered parasympathetic because it's up above C2. It's near the cranial nerves, and we have 4 predominantly parasympathetic cranial nerves, you guys. In most neurophysiology books, they talk about cranial nerves 5, 7, 9, and 10. And some books talk about the eyeball nerves, you guys, 3, 4, and 6. Those are relatively heavy autonomic nerves, and that is one of the reasons that one of the cheaper ways to measure what's going on with the autonomic nervous system is pupillary dilation, right? They put little goggles on people and they measure the dilation and contraction of their pupils, and that can tell you what's going on with the autonomic nervous system. And the cranial suture lines, you guys, excellent place to target the parasympathetics. We know now, this is recent information, just came out in a study a couple months ago, that there's active stem cells in the suture lines of the cranial sutures for life. So as soon as I heard that, I was like, man, I wonder if that's why needling the cranial suture line seems to have such an outsized effect, aside from the fact that it is close to the brain. If those cranial suture lines are releasing some type of stem cells into the brain secondary to needling, that theoretically would be very, very healing for the brain, induce autonomic nervous system homeostasis. And then as far as we understand right now, or as far as I understand, you guys, the most powerful singular place in the body to needle to directly stimulate the parasympathetic nervous system. So remember, if the sympathetics are stuck up here and the parasympathetics are down in the dirt, if you elevate the parasympathetics, it's on a seesaw, so that has to depress the sympathetics. So you can either directly depress the sympathetics and that elevates parasympathetics, or you can directly stimulate the parasympathetics and that depresses the sympathetics. If you do both, if you directly depress the sympathetics by removing tissue pathology, that depresses sympathetics, elevates parasympathetics. If you also stimulate the parasympathetics, that even more elevates parasympathetics and depresses the sympathetics, and that is the direction that we need the autonomic nervous system to go to achieve homeostasis. So as far as structures to needle, you guys, most people are taught to just target trigger points, muscle belly trigger points with dry needling. That is not technically wrong. It's just one of the most ineffective ways to needle people there is. It's the simplest way. It takes very, very little thought process, and it is effective. It's just not anywhere close to as effective as needling with this thought process in mind, which is the primary reason that I made these courses, you guys. If you've needled already, you can just immediately implement this stuff into your practice and maximize the efficacy of your needling. If you don't know how to needle, this will give you a huge advantage when you take a class from me or from somebody else that will give you a leg up to start immediately understanding, okay, this is what my underlying goal with the needling is. How can I go about accomplishing this goal, rather than laser focusing your brain on just the specific tissues that are aggravated? Although, again, that is not wrong. That is very helpful to do. It's just not nearly as helpful as performing needling in this way. So if somebody gave me the option and they said, hey, Jason, you can needle one location only in the body, I would pick the ear 100 times out of 100. If somebody said you can only pick one type of tissue to needle, either muscle bellies or other types of tissues, I would always pick other types of tissues. So tendons, ligaments, joint capsules, periosteum, they're all much more connected to the autonomic nervous system than muscle bellies are, you guys. The tendons have the little Golgi tendon organs in them, the muscle spindles. The joint capsules have all those little types of mechanoreceptors on them. At least in at St. Augustine, we were taught that there's like 5 major mechanoreceptors on the joint capsules that respond to different types of stretch or stress or heat or whatever. And I'm sure there's a bunch more than that. So we've got lots of little receptors on all of our ligaments, our capsules or periosteum, that's much more directly connected to the autonomic nervous system than muscle bellies are. So by needling tendons, ligaments, and periosteum, we have a much better ability to affect the autonomic nervous system than by just needling muscle bellies. However, if you needle both of them, it's even better. So you want to needle muscle bellies, and you want to needle tendons, ligaments, and periosteum, and you want to target the parasympathetic autonomic nervous system. We'll get into all that as we go through class, you guys.